In the name of God, hello. I'm Dr. Niku Yamani, Professor of Medical Education in Isfahan University of Medical Sciences in Iran. It is my pleasure to present in this course and also my pleasure to work with Dr. Nimar Rej for preparing this session. I'm going to talk about educational objectives, emphasizing on Bloom taxonomy, which is a subtopic of the session about principles and approaches to curriculum design. I start my presentation with a sentence from Robert Mager, who says, "If you are not certain of where you are going, you may very well end up somewhere else." This sentence points to the importance of educational objectives, especially in giving direction to learning activities. In fact, the first step in curriculum development is to decide on the program objectives and communicate them properly to the learners and teachers in advance. And failure to do so will result in misdirected learning. So the objectives of this session will be to write learning objectives according to domain and level, to explain importance of classification of objectives, to state uses of educational objectives, to identify qualities of the objectives. So first of all, let's think about this question. Why should we write objectives for our courses? Just think about this a few moments. So what are the purposes of educational objectives? They convey with certainty and specificity what knowledge, skills, or attitude the learners expect to attain from the program. It means that without a clear sense of direction, learners waste time and get on unproductive activities. The objectives also enhance motivation of learners and improve the chances of success. Good educational objectives help the learners to remain focused. They also clarify and convey the expected knowledge, skills, or attitudes to the teachers and determine appropriate instructional methods to achieve the target. It means that they help teachers to select appropriate instructional strategies. And also they can serve as the reference point for selecting assessment methods. So to understand Bloom's classification system, let me say that education usually involves many complex and interconnected activities. So Benjamin Bloom and his co-workers attempted to classify educational activities. In 1956, they proposed three broad categories or domains: cognitive or knowledge, psychomotor or skills, and affective or attitudes. Bloom classification provides us with a useful structure and determines the level of sophistication expected from the learners. Each domain is further subclassified into hierarchical pattern known as levels. So in Bloom taxonomy, we have domains, and each domain we have levels. The higher levels are more complex and intellectually demanding than the lower levels. Generally, objectives at the lower levels are mastered first before higher level objectives are accomplished. For example, once students understand the concepts well, they are able to apply the concepts into practice. Concerning the importance of classifications of objectives, I should say that the taxonomies of the three domains help as guidelines and can lead to more effective instruction. The taxonomies direct attention to the three major domains of learning and to the subdivision of each domains. The taxonomies are arranged in a hierarchical fashion and help teachers to move their learners from the lower to the higher and more complex levels of learning in each domain. But we have to notice that in medical education, this kind of classification could be too simplistic. Tasks in medicine are complex in nature and require substantial input from all three domains. An artificial separation of the tasks is not recommended in medicine. Nevertheless, understanding this schema allows us to approach the educational program in a systematic manner, so they are useful in medicine like other disciplines. So Bloom classified cognitive learning in 6 major categories, including knowledge, comprehension, application, analysis, synthesis, and evaluation. This taxonomy shows learning objectives as classified in a hierarchical fashion from the lowest, which is knowledge, to the highest, which is evaluation. Preliminary levels involve simple knowledge acquisition and utilization of memory. Progressively higher levels include an understanding of the meaning of the newly acquired information and application of the knowledge. The top levels require increasingly more complex mental processes and include analysis, synthesis, and evaluation. Actually, the Bloom taxonomy was revised in 2001 by one of the Bloom's collaborators, David Krathwohl, and his group. The revised description used dynamic verbs instead of the original nouns to describe learner thinking. Knowledge was changed to remember, comprehension became understand, and apply, analyze, evaluate didn't change, and synthesis was named create, and the create level is at the top of the revised taxonomy, above evaluate, because creation involves innovation and needs higher order thinking compared to evaluation. So let's explain different levels in cognitive domain. The first one is knowledge. It is the lowest level of Bloom's, is the ability to recall or remember previously learned materials without much understanding of the meaning. It is the ability to recall specific facts or common terms and to identify part of the diagram. Some verbs for writing the objectives in this level could be list, write, or identify. For example, by the end of this lesson, students shall be able to label different parts of the human brain. Or, by the end of this session, students shall be able to define the clinical criteria of an abscess. As you see in this level, the students does not have to think much, just remembers, recall, and recognition. Comprehension is the ability to understand the meaning of an idea or a concept. In this level, students are able to understand, interpret, and summarize the concepts learned in the knowledge phase in their own words. Some verbs could be differentiate between discriminate or interpret. For example, by the end of this lesson, students shall be able to explain how sensory receptors in our brain detect stimuli, or the students shall be able to describe the pathophysiology of an abscess. The third level is application. At application level, students are able to apply facts, ideas, and concepts into another context. Some verbs could be applied, demonstrate, or operate. For example, when provided with a given formula to calculate body surface area and a drug dosage handbook, students will be able to write down the correct dexamethasone dosage regimen for a particular patient. Or, for example, the students will be able to propose management of an abscess according to approved guidelines. The fourth level is analysis. Analysis is the ability to separate a large concept into component parts and establish relationships between the parts. It could include the ability to determine the relevance and usefulness of information and correlate between the information. Analysis could be the critical appraisal of knowledge. Some verbs such as analyze, categorize, diagnose, or outline could be used for writing the objectives for this level. For example, students will be able to outline the components of a care plan to monitor the anticipated side effects of dexamethasone therapy, or students will be able to compare and contrast prokaryotic and eukaryotic cells. Evaluation level is demonstrated by the ability to judge the worth of data against stated criteria. The criteria are important for this level. It could include the ability to judge the value of a research paper, compare between treatment modalities, and select appropriate treatment guidelines for a given patient population. It is the ability to judge the worth of data against stated criteria. Some verbs like judge, compare, or validate can be used to write the objectives in this level. For example, students will be able to explain which kind of medicine is better for leukemia and why. Or students will be able to appraise the practice of social media advertising in business. Or students evaluate the validity and reliability of the information used to diagnose abscesses in various settings, such as diabetic patients. The last level in revised category is synthesis. It means constructing new ideas or hypotheses and establishing new relationships between the theories. It could include the ability to write a well-organized theme or writing a research proposal and planning an experiments. For example, students will be able to compose the scientific name of an organism, or students will be able to propose a hypothesis that will explain the possible mechanism of adverse neurological outcomes associated with prolonged dexamethasone usage. As I mentioned, in this level, a student can create an original piece of work. Some verbs could be like construct, synthesize, or propose. For writing good objectives in cognitive domain, we have to know the proper verbs. In the left side of this table, you see some non-specific verbs like know, understand, appreciate, encourage, realize, or remember. These verbs are not specific and are not measurable or observable, but the other verbs in the right side, like identify, describe, evaluate, recognize, they can help us to write good objectives which are specific, measurable, and observable. The next domain in Bloom taxonomy is affective domain. Actually, we all know that education must be concerned with the values, beliefs, and doubts of students. These are just as important, if not more so, as objectives of cognitive domain. Affective objectives are both difficult to identify and to measure, and these difficulties could be the reason why teachers are not willing to write affective objectives. Actually, this is a domain that is often associated with professionalism in medicine. If affective learning should be taught and values should be among those learnings, then identifying common values is an essential task for the curriculum planner. Affective domain consists of 5 major categories: receiving, responding, valuing, organizing, and characterizing. So what are the levels? The first level in affective taxonomy is receiving or attending. In this level, it is expected from learners to have awareness and willingness to receive and show selected attention. For example, The student will actively listen while others express their point of view. Or students listen for and remember the name of newly introduced people. As you see, you notice attention in these examples. Some verbs that we can use in these objectives are like locates, names, points to, or selects. The next level is responding. In responding, learners are supposed to participate actively and attend and reacts to a particular phenomenon. It means that we need active participation on the part of the students. For example, a student participates in class discussion or gives a presentation or questions new ideas, concepts, models, etc. in order to fully understand them or know the safety rules and practices them. These all shows that the student is actively participating. Some verbs could be like discusses, grids, helps, or labels. The next level is valuing. Valuing is based on the internalization of a set of specified values, while clues to these values are expressed in the learner's overall behavior. It is expected from learners to have preference for a value and commitment toward values. He has to be committed towards these kind of values. In this level, the student is sensitive toward individual and cultural differences in patients. It's kind of value diversities. For example, a student proposes a plan to social improvement and follows through with commitment. Or a student informs management on matters that one feels strongly about. It's concerning discriminations. Some verbs could be like compares, completes, defends, explains, and so on. The next level is organization. The emphasis is on comparing, relating, and synthesizing values. In this level, we are dealing with conceptualization of values and organization of a value. For example, a student accepts professional ethical standards, or a student creates a life plan in harmony with abilities, interests, and beliefs, or a student prioritizes time effectively to meet the needs of the patient's family and self. Some verbs for this level are identifies, integrates, modifies, or orders. The last level in affective taxonomy is characterization by value or value complex. In this level, the behavior is consistent, predictable, and most importantly, is the characteristic of the learner. In this level, the learner develops a consistent philosophy of life, has a value system that controls his or her behavior. For example, the learner displays a professional commitment to ethical practice on a daily basis, or values people for what they are, not how they look. And as you see, there is internalizations of values in this level. Some verbs could be like influences, listens, solves, verifies, and so on. The third domain is psychomotor domain. This domain is demonstrated by physical skills such as coordination, manipulation, strength, and speed. For example, in clinical medicine, it could include like setting up of an intravenous drip, airway intubation, and laceration repair. The psychomotor domain is a combination of psycho, which is knowledge and cognition, and motor skills. In medicine, the psychomotor domain has a significant knowledge component. For example, in airway intubation, background knowledge of the upper airway anatomy and also disease processes is an essential prerequisite for a student to know them and be able to do the intubation. There are different categorization for psychomotor domains, such as the category of Dave, Kilber, and Simpson. Here I present Simpson categorization, which actually has 7 levels, but in this slide you see 6 of them. The first one in this slide is set. In this level, we are concerned if the student is ready to act physically, mentally, and spiritually. For example, students will set up lab equipment for experiments. In the next level, which is like guided response, a student is actually as a beginner and learn through trial and error and by practicing. For example, a student follow manual to run a machine or try to do a procedure step by step as he observed before from, for example, his or her mentor. The next level is mechanism, which is kind of intermediate level, and the learner develops proficiency and action becomes kind of habitual. For example, cognitive rehearsal of a physical task or performing gross motor movements. The next level is complex responses. Actually, this level is kind of expert level, which learner has high proficiency and performs with accuracy. For example, operate and run machines efficiently, or does a medical procedure with proficiency and confidence. In the next level, which is adaptation level, skills are strongly developed and can be modified in different situations. So the learner revises and improves procedures. In the next level, which is origination level, the learner creates new procedures and solutions to approach various situations and creates its own process in executing physical tasks or creates new ways of doing a medical procedure. You see the action verbs for each level below them. Another thing that I have to mention here is most of the time we can determine the level for cognitive and affective domains from the verbs we use for writing objectives. For example, if we use the verb list, it shows the first level of cognitive domain. And if we use the verb explain, it shows the second level, which is understanding. But for psychomotor domain, it is very difficult to judge the level from the verbs we use for writing the objectives. And we need some more indication to judge about the level of the objectives. For example, if we use demonstrating, it could be in different levels. If the learner demonstrates with assistance, it's for the second level. But if he demonstrates independently, it could be in the fourth level. So we cannot judge for the psychomotor domain according to the verb used in writing the objectives. Let's provide more examples for psychomotor domain. Examples from intubation. In perception level, which is the first level, the student is physically and mentally ready for doing the intubation and knows all the devices and tools he needs to do the intubation. In the next level, which is set, the student observes how the residents or faculty intubates the patients step by step, or he watches movies to know step by step how to do the intubation. Then he practices step by step on mannequins. And in the next level, which is guided response, he is guided by a mentor to intubate a patient, preferably unconscious patient. And in mechanism level, the student practices more and more. And in the next level, which is complex overt response level, the students will do intubation with confidence. In adaptation level, students can do intubation in complex patients. And about origination level, which is the last one, I should say that it does not happen always. It just happens in some situation that we could deal with innovating new ways of doing things. I should say that these levels are all happening when our students are learning skills and procedures. But by defining psychomotor objectives, we can help them to learn better and more systematically. In order to write good quality educational objectives, we should know the criteria of quality objectives. One of them is a SMART framework. Actually, SMART is an acronym that stands for specific, measurable, achievable, relevant, and time-based. Each element of the SMART framework works together to create a goal or objective that is carefully planned, clear, and is trackable. Let's talk about these criteria. Specific means to be as clear and as specific as possible with what you want to achieve. It means that the objective should be specific. Measurable means that what evidence will prove you're making progress toward your objective or goal. So the objective should be measurable. The verb that we use for writing the objective should be measurable. Attainable means that you have to make sure you can reasonably accomplish your objective within a certain time frame, which will help keep you motivated and focused. Relevant means that each of the objectives should be aligned with your values and larger long-term goals, and also relevant to the needs of the society. And time-based means that the objective should be realistic and achievable in your time frame. So for writing good quality educational objectives, we have to respect the SMART criteria. In another word, characteristics of good educational objectives are learner-centered, specific in describing the learning outcomes, pertaining to measurable or observable behaviors, high in clarity and easy to understand, and relevant to the goals and health needs of society. Let's provide some examples. One example for poor educational objective is students shall know about the childhood vaccines. As you see, this objective is not measurable. It could be relevant, but it's not specific and measurable and observable. But a good example could be students shall correctly describe the routine childhood immunization. The verb describe is measurable, and this is also relevant and specific. So the last example has the quality criteria. This is another acronym for quality objectives. It's relevant, observable, measurable, feasible, clear. ROMFC. So let's read some example and see which criteria goes for those examples. You see at the right side the criteria R, O, M, F, and C. For example, the learner shall be able to administer a drug by intramuscular injection. Which of those criteria you can find in this example? Yes, it is relevant, it is observable, measurable, feasible, and clear. The next one is the learner shall be able to list 3 major causes of abnormal gait. Which criteria? Yes, it is relevant, it is observable, measurable. Is it feasible? Yes. What about clear? For some, it may be not so clear. Another one, the learner shall be able to understand bleomycin. Is it relevant? Maybe, but it's not observable, it's not measurable, it's not feasible, it's not clear. Yes. The next one is, the learner shall be able to know iron content in various food products. Is it relevant? Yes, maybe, but it's not observable, not measurable, not feasible, and not clear. The last one is, the learner shall be able to convince patients relative for blood donation. Which criteria? Yes, it is relevant. Yes, it is feasible, observable. I'm not sure if it is measurable, but it is clear. So, by respecting these criteria, we can have good quality objectives. To conclude this session, I have to say that the use of taxonomies of the 3 domains as guidelines can lead to more effective instruction. And also, the taxonomies should serve to stimulate teachers to move their learners from the lower to the higher and more enduring levels of learning in each domain. And also developing higher order thinking skills by applying higher levels of Bloom taxonomy should be the aim in education, especially in medical professions. Also, educational objectives can help teachers to select proper, appropriate instructional methods and also guide them for proper assessment of students. Educational objectives should be learner-centered, short and precise descriptions of what learners are expected to achieve at the end of the program. So, structuring appropriate, predefined learner-centered objectives for each teaching session enhances learning outcomes and enables measuring objectives. So, these are some of the references I use for preparing these sessions. Thanks for listening, and I hope the content of this session has been useful for you. Goodbye and good luck.